how are you? I am back with another topic that is common, and this is premenopause. What premenopause means is usually around menopause. You haven't started menopause yet, but you are around menopause, so it's called premenopause. And basically, what it is the hormones in your body are fluctuating. The main hormones in this case is progesterone and estrogen. They fluctuate. For most people, it's anywhere from 40 and above. But genetically, there are some people who start in their late 30s, anywhere from 35 and above, where now you start noticing changes to your body. Your periods are maybe too heavy, or they go lighter, or you're bleeding more often. Those are some of the changes you will notice. But it's just your hormones. Your hormones are all over the place. That's what premenopause is. It starts early. It's not an accumulation. It is you start noticing symptoms here and there, here and there. And by the time you notice it's accumulation of those symptoms that has come to where you're like, what is going on with my body? And for most people, it's quite a transition. There are many signs and symptoms for it. Different people achieve differently. It's a huge topic. It's not one that you can put in one video. So I will talk about premenopause, the signs and symptoms, and I've told you it is the hormones. And basically in a woman my age, because I'm premenopausal, is decrease in estrogen, progesterone, mostly estrogen. So this estrogen, I'm looking at notes, so if you see me looking aside, it's because I do have notes. The estrogen will rise and fall. So the estrogen rises and falls unevenly during premenopause. That's why you're getting all those symptoms. So it rises and falls very unevenly during menopause. I said periods may lengthen, they may shorten for some people, but you can either be or. If you were somebody who was having periods for 7 days, occasionally you go down to 5 days, or you may still have them for 7 days, and even in 7 days, they're not as heavy as they used to be for those people who have what we call menorrhagia, heavy periods. You may experience, some people in menopause may experience the hot flashes. It's not so common usually, but it comes mainly with menopause, but occasionally some people in premenopause can experience the hot flashes. There are treatments available for it if you choose to. If you don't choose to, most people can fight it with exercise and changes in diet. Pretty hard to fight, but you can. When you get to menopause, that's when you have not had a period for consecutive 12 months. If you haven't had a period for 6 months, you're still premenopausal. For you to be considered fully menopause, you have not to have had a period for 12 consecutive months, meaning January, February, 12 of them. That's when you can say you're fully menopausal. But premenopause is if you're still having it. Even if you have it sporadically, every 3 months you have a period, every 4 months you have a period, you are still premenopausal. But the moment you go 12 consecutive months without a period, then that is when you are considered menopause. It is a transition. For Caucasians, it takes about 7 years between the two. African Americans, Black, it takes 10 years. Symptoms are worse. It takes 10 years. Not worse necessarily, but prolonged compared to Caucasians. Symptoms, as we talked about, irregular periods, hot flashes. By the way, there are so many symptoms, I can't go through it. I guess the average is about 45 symptoms, but I'm just going through a few of them. And as I said, it's not a topic for one day. It's a topic that we will go in pieces until we finish it. But irregular periods, hot flashes, mood changes. Oh my goodness. You have people that have known you and all of a sudden they feel like you're too moody, or you get angry quickly. Nothing to do with you. It's your hormones. It's your hormones. It's hard for somebody to understand who is not going through it. So if you have people around you, you can always let them know those are the changes you're having in your body. This is what's going on. Out of your control. It's hard to control. Some people are able to, but for some people it's really hard to control. You can go within one sentence of smiling and crying in the same sentence. So those mood changes, mood swings, vaginal and bladder problems, part of it. You start going to the bathroom more often. This was not usual for you. You would sleep a whole 14, 12 hours without getting up, but now you get up to go to the bathroom. And even if it's not nighttime, during the day you find yourself drinking lots of water, but going more often than you would in before your premenopause years. Decreasing fertility. At that point, ovulation becomes irregular, so your fertility is decreased for sure. Changes in sexual function. It depends. Some people have more affinity to sex at the time, and others decreased libido is what we call it. Most people is decreased libido, but those are some of the changes that come. Loss of bone, because you're growing, you're aging, so you do lose. You do have to check on your bones. Take supplements for it if you can. It increases your risk of osteoporosis, basically, because your estrogen is low. When your estrogen is low, you have a high affinity for getting osteoporosis if you fall down or something happens to you. Declining estrogen levels also makes your labs change. Do you need labs to say that you are premenopausal? No. The signs and symptoms will tell you you are premenopausal. You don't need labs to tell you that you are premenopausal. If you look up signs and symptoms of premenopause, they'll come up. Some people prefer labs. You can do labs, but in all honesty, you don't need labs to tell you that you're premenopausal. The signs and symptoms, which are 45 to 47 of them, will tell you what they are. I can't even mention all of them here, but I will do a video just mainly on signs and symptoms of premenopause. Do you seek to see a doctor at the time? There are some people who have an OBGYN that you can go see, and don't let them tell you it's in your head. It is your body, you are experiencing it. Don't let them tell you it's in your head. If you do get an OBGYN that tells you it's in your head, seek another one. There are many options out there. Menopause Society of America, it has listed people under there that you can go see that are menopause friendly. So if you're in premenopause, not necessarily menopause, premenopause, menopausal, seek a menopause friendly OBGYN doctor, physician assistant, nurse practitioner, whoever it is that you prefer to see. Seek them. You do not need to be paying insurance. Or for some people who don't take insurance, you do not need to be seeing somebody who's discounting your symptoms. No, change. Life's too short. Life's too short. We talked about the causes. Your body's production of estrogen and progesterone has decreased. That's all it is in your body. That's what's going on. The key hormones fall and rise. So they are all over the place. They are not as consistent as they used to be. And that's why you're getting the symptoms. My camera is at an angle for some weird reason, but just bear with me. I don't know why it does that. I put it at a higher level so I look like I'm lower, but I just didn't feel like standing. That's why it is in the position it is. Bear with me. Are there risk factors for it? Yes, you do have risk factors. It's a normal phase of life. Everybody goes through it, whatever it's starting. If it starts at 35 or at 40, most people start at 40. You do have people who their parents started earlier, like 35, and those people may start earlier, but generally for most people, majority is 40 and above. There are risk factors. If you're smoking, that worsens the symptoms, you know. It will make you start the menopause symptoms 1 or 2 years earlier, prior to when you were to start. So smoking is a risk factor. Family history, as I talked about, you do have family history that some people started in their late 30s, which is unfortunate, but it does happen. So some people started in their late 30s, and so their parents the same, and so when they get to late 30s, then they start with it. So that's family history. If you have treatment for cancer with chemotherapy or pelvic radiation, this also can lead to you having early menopause. Hysterectomy in some people causes you to go into early menopause. So those are the main risk factors. There could be others, but a surgery like hysterectomy can make you go into early menopause. Some people will mention to you, oh, when I had my hysterectomy, I felt like I was depressed. Those are the symptoms of menopause, pre-menopause. So if you do have a hysterectomy, occasionally you're fine, but most of them, it does make you feel different than you were prior to your hysterectomy. Most people will get a hysterectomy, no problems at all. They'll go. But a small amount of people, it does throw them into those symptoms. Complications, irregular periods, that's a hallmark of premenopause, menopause, irregular periods. When you're menopause, you pretty much have not had a period for 12 months. But if you're premenopause, you'll get the irregular ones. It comes 1 month, it disappears for 2 months, and then it comes back. Those are your irregularities. You can have extremely heavy periods or prolonged periods. If they're too prolonged, follow up with your OBGYN or whoever sees you for your female care. Bleeding occurs between periods. Those are some of the things that people will experience. If it occurs between periods and you're not fully menopausal, it's also something to look for, just to make sure nothing else is going. Occasionally, they'll do a vaginal ultrasound, transvaginal vaginal ultrasound, just to make sure that nothing else is going on. If you are having periods for every 30 days, occasionally you'll get them every 21 days to the clock. To the clock or not to the clock, whatever it is. It's just, it is so different for everybody that there is no one size fits all. So that is why you need to have a provider that you see, that you can walk through, and they can walk you through the symptoms. So those are the main topics for today. We will continue on this topic. As I said, it is wide and we will need to talk more about it. It's just not nice to put a video that takes that long, because then the concentration goes away. Okay, we'll come back and talk about treatments for it, if you choose to have treatments, and if you choose not to have treatments. They are all good options. Everybody has an option. What works for you is what you choose, not to go by what others think you should do. All right, and as I said, my name is June. I'm a nurse practitioner, but I'm not your nurse practitioner, so always follow up with your medical provider. You guys have a great week. Nice talking to you. Bye-bye.